Hello, okay, well, we're going to get started. Good morning to you all. Just to make sure you're all in the right place, this session, as it says on the slides, is about the adoption and spread of innovation in the NHS and drawing on the experience from our colleagues working in the Accelerated Access Collaborative and the AHSN Network in a moment. So for those of you I've not met before, my name's John Siddle. I'm the Chief Executive of the Southwest AHSN. So we're one of 15 academic health science networks set up around the country to try and transform lives through health and care innovation, working very closely with our colleagues from NHS England and the Accelerated Access Collaborative. So today you're going to hear about the approach we're taking at both a national, local, regional level to try and support the adoption spread of innovation in the NHS, and specifically look at what we're learning about how to do that in practice and some of the principles that guide us in the way we're approaching that, working with colleagues across the country. You're going to hear from three speakers. In a moment, I'll introduce you to Christina Farrow, Deputy Director of Innovation at NHS England. Laura Semple, who's our National Programme Director. Laura leads our portfolio of national programmes, and Stuart Monk, one of our National Programme Managers. So that's the plan for the session. We're going to try and speak for around 20 minutes. So it's around 5 minutes each for each of our speakers. And then we'll open to a Q&A. Really keen to hear your reflections and learning to bring into the conversation as well. Great. So Christina, over to you.
That's great. Thanks, John. And lovely to see so many people joining us this morning. I'm glad you could all make it in the doors. It's been a bit of a challenge this morning. So as John said, I'm Christina. I'm the DD for Innovation and the... Okay, sorry. Thanks. I do speak quietly anyway, so just wave at me if you can't hear me at the back. So I'm Christina Farrow. I'm the DD for Innovation in the Innovation Research and Life Sciences team. And I'm just going to talk briefly about why learning from adoption and spread is important to us at NHS England, and then I'll hand over to AHSN colleagues to take the conversation further. So our Innovation Research and Life Sciences...
Just be slightly closer to the mic.
Yeah, sorry. If you can't hear me, please just start waving at me. So our Innovation Research and Life Sciences team delivers the research and innovation programmes on behalf of both NHS England and the Accelerated Access Collaborative. And the AAC has really been brought together to bring patient groups, industry, health and care organisations, regulators and the NHS together to remove the barriers for innovation adoption and accelerate innovation being used, so groundbreaking new treatments reaching patients faster. And we want to support innovations that have the power to transform people's care pathways and their health outcomes. So we support all types of innovations, so medicines, diagnostics, medtech, AI, and workforce model changes as well. And we're really interested in, as well as speeding up the adoption of innovation, understanding how can we make the NHS a great place to innovate as well. So the AAC has 6 core priorities, which you can see on the slide here, and we really want to tackle the most challenging and urgent healthcare challenges to focus on what matters to patients and really co-create with our delivery partners and with industry and with our healthcare systems. So when we think about creating that culture of innovation, this is about really developing NHS programmes that can support people in the front line and people in workforce so that research and innovation is really embedded in day-to-day activity. So we also want to support the life sciences sector so that the UK is one of the best places, the most pro-innovation healthcare places to work in the world, and so that all patients can access the best new technologies and treatments. And we know that innovation can be a really powerful tool for improving health and care that people receive, but we also know that we're not taking full advantage of that. So we need to learn from what's happening to support systems. And the COVID pandemic has really shown that we're not providing equitable access of care to these innovations. So what are we going to do to improve that? So the work that the AAC did with the Care Quality Commission really showed that despite our advances in technology development, we could be much better at spreading innovation. And it's our job to understand what matters most to patients themselves, where can innovations tackle the most pressing challenges, and how can we focus on communities with greatest need to really address the health inequalities that we've seen and the issues that were really signalled to us during the pandemic that we see across the country. So our AAC programmes span the whole of the innovation pipeline. So we go from supporting ideas through proof of concept, through testing in real-world healthcare settings, and then through adoption and spread. And the AHSN support all of these programmes that you can see on the screen here. And so this is where the AHSNs come in really. With our NHS England Commission, we can focus on outcomes and impact, and we can respond to different environments and take their learning from the adoption and spread of innovation to inform our NHS England policy to make sure we're supporting people to adopt the best ideas that are out there. So thinking about a few of the programmes, and this is really just on the innovation side and the adoption and spread, how we build capacity and capability within systems. There's lots and lots of different programmes on here, so I'm just going to pick out a few, but more than happy to talk about other things that we're doing. And really this comes from learning from the Health Foundation and King's Fund and other areas which, the Spread Challenge report really highlighted that healthcare innovation programmes need to be designed to support the adopters of innovation as well as the innovators themselves to develop the technology. So we're working with AHSNs and other key partners to look at the capacity for staff and organisations. We're also working with other key partners such as Health Education England, the NHS Leadership Academy, to really develop that innovation adoption training for people on the front line, so that if you're a clinician or somebody working in health and social care and you want to adopt innovation in your area, you're given the skills and the knowledge, the resource, the support that you can achieve that really. So our Innovation Adoption Education Programme, we've worked with KPMG and that scoping exercise is finished, and now we're working with those partners to really develop that. We're also looking at organisational capacity, and we're doing that through part of our NHS Insights programme. So we've match funded 10 organisations across England to say, how do we develop the suite of products and develop the support, and how do we take that learning and so that other organisations can build that capacity, build the skills, build the knowledge, and that really is the remit of the AHSN. So I'll hand over to Laura now to tell you a bit about more of how that's happening in practice.
Just going to try this mic to see if it's any better. Can see a few nods. Excellent. So we'll go with that. So yeah, lovely to see everyone. Lots of familiar faces and some new ones. I'm going to talk a bit about the learning we've had so far on how to do adoption and spread really successfully, and some of the things we've got coming up. So for anyone who's not already familiar with AHSNs, just want to give you a very quick overview here. There are 15 AHSNs in England. If you're not already connected with your local one, there are lots of people here today who'd be only too pleased to talk to you. And on all of your seats was our impact report from last year. So that will give you a perfect insight into everything that we do. But this just sets out our mission as regional bodies that connect all the organisations that really do need to be involved for innovation to be successfully spread. So hopefully you can see your local one on there and get in touch if you're not already working with us. So we've recognised for quite a long time now that successful adoption and spread of innovation does not happen by itself. It requires a lot of hard work, a lot of really practical, what we would call boots on the ground support, which is exactly what AHSNs can provide. And a couple of years ago now, we decided to look into this in a lot more detail and actually do a structured review to understand the methods in use across the network, and what we can all learn from each other. I'm not going to dwell on all of the methods and findings of the review today, but would really encourage you to read it if you're interested. But I think the main point I want to get across is that all the findings from this review are based on nearly 10 years now of really practical work on the ground, getting innovations into practice. And I think that's the insight that we can offer that's a bit different from think tanks, for example, although we have drawn on their very useful work. So to just give you a flavour of some of our impacts, in the last financial year, 480,000 patients directly benefited from our programmes across England. We have national programmes in all the areas that you'd expect: cardiovascular, mental health, respiratory, maternity and neonatal care, to name just a few, and there's many more. So there's really something for everyone here, and we're addressing the major population health and health inequalities challenges that we're facing. So to just give you a brief insight into where we're taking the findings of the review, we want to do quite a lot of work together as a network of 15 networks to better understand which structures, which approaches to competency development, both for our own staff and also for our partner organisations in the trusts and ICSs that we work with. We also want to get much more systematic about understanding context, and I'll come back to that in a moment. Stuart's going to talk a bit more in a moment about the key principles of spread and adoption that really apply whether you're trying to spread a pharmaceutical, a medtech product, an NHS-grown innovation. And finally, we want to be more effective at sharing these in case studies. So, as I briefly mentioned a moment ago, we're really conscious in doing this work. We stand on the shoulders of giants. For example, Trish Greenhalge's group at Oxford produced an incredibly helpful framework which we're working with. I hope everyone here has come across the Spread Challenge from the Health Foundation. If you haven't, that's a brilliant, really accessible read and really practical advice on how to do this type of work. Christina mentioned the collaborative work we've done with the CQC, which again, incredibly helpful starting point. And I expect many of you have seen the work that NHS Horizons have done on the 7 interconnected principles for spread and adoption, which again is well worth a look if you haven't already seen it. And that neatly segues into Stuart's section, where he's going to talk us through those key principles. So over to you, Stuart.
Thank you, Laura. It's great to see so many people here for this. Thank you for coming again. So I'm Stuart Monk. I'm the AHSN Network's National Programme Director for some of our technology-based spread programmes. I've been fortunate enough to have been involved with the AHSN Network for almost 7 years now, working with John and colleagues at Southwest AHSN, and then latterly, for the last year, coordinating the delivery of these programmes across the AHSN Network with all 15. I guess the first thing to put this, or what I'm about to describe, into context is passion and energy. That's something that all of the AHSNs have for the spread and adoption work that they do. And I think I'll probably speak on behalf of all of my sort of close to 800 or 900 colleagues in the network that this is where we really get our energy from. We are all so passionate about this challenge and seeing successful spread and adoption of innovation. So what I'm about to talk you through, if I can get the slide to move. There we go. Are 5 key principles that are front of my mind, front of colleagues' minds when it comes to successful spread delivery. So I'm going to take you right into the heart of programme delivery here. The first one is an obvious one. What is the thing that you're spreading? What are its key ingredients? What are the important bits of it that the evidence base has been built around that you need to have front of mind with the people that you're going to be working with? But then also around that, which bits can be adapted to suit local context. I'm going to come on to context shortly, because that's really important too. England, where we work, is very diverse. There are urban areas, rural areas, coastal areas. They've all got different priorities, challenges, and the innovation should have some flex, but at the same time, it will have key things that need to stay true to the way that the evidence base has been built. To give you an example, the AHSN Network delivered an exercise-based intervention a couple of years ago as one of its first national programmes for people with osteoarthritis in their knees and hips. And when we started to do that, we found that many parts of the country had similar exercise programmes that maybe didn't run over as many sessions as the one that we were working with, or that maybe did patient education in a slightly different way. And AHSNs were able to get right into the heart of those conversations, help those sites understand the equivalency of what they were already doing, aligned with the programme that we were delivering. So that's really important. Second principle is around understanding context, which a few of us have touched on now. So this works on different levels, I suppose. It's thinking through if the innovation is pointed towards acute hospitals, mental health providers, or primary care. What does that mean for the priorities of those organisations and the way that they work in terms of how you might describe the benefits of the innovation in different terms? And then also, what's going on around those organisations? So again, where are they sited? Are they in an urban area? Are they rural? Or what are the needs of those populations that they serve? And how does that relate to the innovation or the intervention that we're trying to work with them on? So the third one This is straight out of the quality improvement textbook for those of you that are familiar with quality improvement. And I'm always reminded of I think it's Don Berwick quote, "Some is not a number and soon is not a time." So how much of the thing are you trying to spread and when are you going to do it by? And that's really important to us in the AHSN network. Generally, our programs run over a 2 or 3 year cycle, and we want to try and enable as many patients in the country to benefit from that innovation as possible. And it's how you think that through relative to the organisations you're working with. If you're spreading something into general practice, then that's a lot more organisations than spreading something into an acute hospital. So you need to feed that into your programme plan as well. So this is another one of my favourites it's thinking through your planning and your rhythm and your drumbeat, and that links to the previous point. You know, if this is a high priority innovation that needs to be spread quickly, how do you create the drumbeat, using that dragon boat analogy, in your team to try and build momentum, to try and get the thing spread as quickly as you possibly can so that people can benefit? A lot of the interventions that we work on are, they are safety focused. They save lives in many cases. So this needs to be done as quickly as it possibly can be in some cases, and making sure that you're using the right drumbeat in your team, the right methods and activities to take people through that change cycle is really important. So a good plan. And then finally, the human element that we all know and love, the biggest barrier. You're working with people, clinicians, commissioners, managers, directors of finance, and you're going to need to get to know them. You're going to need to get to know what makes them tick, what makes their teams tick, and what their organisational priorities are. And I use the insights image that some of you might be familiar with. I think that visualises nicely differences between people. You need to be cognizant of that, and all AHSNs are. You need to build relationships. You need to find a way of ultimately putting the innovation or the intervention in terms that helps people to do what they're already probably trying to do somewhere along the line. So those are the 5 principles that we all live by in the AHSN network. I think I'm going to hand back to you now, John.
Thanks, Stuart. Great. So what you've heard there is the national policy context from Christina in terms of the way we're thinking about at a national level, broadly the foundations and the conditions we put in place nationally to try and support adoption and spread of innovation. Laura's hopefully shared with you how we think about that as a network, some of the impact it's having, and then some practical examples from Stuart on the ground of how we do that in practice to take something we know works in 1 or 2, maybe 3 places and spread that across the country at the heart of what AHSNs do. I'm going to open to questions in a moment, so please have a think if you've got any questions or reflections for the speakers, and thank you to all of you for your time. But I just wanted to draw on one element of Stuart's presentation, which also came out in Laura's as well, which is the importance of context. So this, for me, is at the heart of why AHSNs work in the way that we work and why that works in terms of the adoption and spread of innovation. It's the deep understanding of that context. So Stuart talked about context in relation to place. So whether we're spreading something into a rural coastal environment like the place we work with in the southwest versus maybe an urban area like Manchester or London, the reality of the way in which you need to adopt the innovation and realise the benefit for patients can really vary. We've also talked about context in the relation of a pathway, so the nature of the particular part of the system, the particular pathway we're trying to implement and adopt innovation can also have a big impact on how we approach that as well. And what we experience is that although a point intervention or innovation feels like the solution, the reality is a full pathway transformation is often required, or at least elements of that, in order to realise the full benefits of it. But the final one that I just wanted to draw on before I open to questions is the context of the system that you're working in, the conditions of that system, the capacity of that system, and the access to the capabilities that it has. So as well as the work we do on the ground, practically delivering programs in the way you've heard today, a key part of the way we work with the AAC and with AHSNs across the country is about building the capability of our systems to be able to innovate and adopt innovation in the way we've described. And that combination of both building capability as well as supporting systems to put this stuff into practice, for me, is at the heart of why context is so important to this work. So thank you to Stuart, Christina, and Laura.